Good morning, everyone. It's Friday, the 25th of February. As you will know, I have moved my videos to a monthly video, but I'm specifically doing a video this week because, as you're probably aware, the government announced significant lifting of COVID restrictions for the general public on Monday this week. However, at this stage, that actually doesn't make a massive difference to the RHN. Partly because, along with other healthcare organisations, at this stage, specific guidance for healthcare organisations has not been issued. Also because, of course, we have to continue to protect our vulnerable patients and residents. There is still a high circulation rate of COVID in the community. And we have had, in the last week, an outbreak. It's a confined outbreak on one ward, but we've had an outbreak of COVID on Wellesley, where we had 5 patients and 3 members of staff test positive. So for all those reasons, we are continuing with the measures that you will all be very familiar with. Anybody coming to the hospital, whether it's to work here as a member of staff or as a visitor, must carry out a lateral flow test and can only enter the site if they present a negative lateral flow test carried out that day. That means, of course, that although now the national guidance is that if you test positive, you don't have to self-isolate, that might be fine in the community, but it certainly isn't fine for coming to work here. And it's very important that anybody coming onto site test negative. Carrying out those lateral flow tests, we think, is our main way of protecting people at the hospital from the circulation infection. But once in the hospital, at the moment, we are continuing to make the wearing of masks mandatory and social distancing. And of course, all the other usual measures like hand washing, etc. Now, you may be wondering what will happen from the 1st of April, in just over a month's time, when the provision of lateral flow tests for the general public ceases to be on free issue. And I have to say, at this stage, it's really watch and wait. We will be closely monitoring the situation to see how that is handled by the government and by the health service between now and April. One piece of good news, from Monday we are increasing the frequency of visiting for residents and patients to 4 times a week. And we're likely to stay at 4 times a week for the next month or so. Although, as with everything else, we're very keen when we can to be able to introduce more flexibility and indeed reduce restrictions. But at the moment, things are as I've just described. So thanks for watching, and I will give another update soon.